Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing a COVID-19 update. We'll be doing them every other week. Today's date's December 5th, 2022. To keep things consistent, I'm still doing it from Thursdays, so I'm pulling the numbers on Thursday. So this would be from the 1st, the data. So falmouthma.gov is our website. health@falmouthma.gov is our email. Phone number is 508-495-7485. 5,803 cases since the beginning of the pandemic. Again, that's PCR. So PCR numbers are what they are since about almost a year, roughly about 11 months since the home tests came out. And so since then, those aren't tracked. So the numbers are higher since mid-January, especially since probably the early spring, where everybody sort of switched over to home kits, which are not tracked. So the case numbers are what they are. But the way to look at the PCR tests right now is if PCRs go up, you can sure as bet that the home kit tests are up. So if cases are up, if PCR goes up, it's just you don't have an accurate number. We just don't. But I'll give you what the PCR is. The PCR numbers, all the data is based on PCR. 62 confirmed cases over the 2-week period from the last time I did this, so from the 17th to the 1st. Averaging a little bit higher, about 29 cases per week over the last 4 weeks. So we were at like 47 for 2 weeks last time. So, and you'll see that the cases are up a bit with PCR, so then they're going to be up a bit with home tests. Our incidence rate went up 2.6 to 11.4 and up 1.9% to 7.24% over the 13th to the 1st of December. So a bit of an increase, not surprising. It's getting colder, it gets dark at god-awful 4:30. People are indoors. People have gone visiting relatives. We've had Thanksgiving. This number's not bearing at all of Thanksgiving, but there's going to be an increase, and it's going to happen this way from now on. It happens with all your colds. It happens with the flu. It starts about this time. And so it's not surprising that you see a bit of an increase. Not off the chart increase, just a moderate increase. We're in the yellow medium category for the CDC's guidance on community level transmission. We're up. So our case, essentially to be low, you need to have a case rate under 200 per 100,000. Then you have to have a hospitalization of new COVID-19 admissions per 100,000 of less than 10, and a percent of all staff patient in beds being because of COVID at less than 10%. We've never got above near 10%, 3.1, about the same as last time. Up about 1.8 new COVID admissions per 100,000, so a slight increase, and up 20 cases per 100,000. So we're still below the 200 or at 97. This is the number that usually puts us between green and yellow. So from low to medium is this new COVID admissions per 100,000. So, we hover between 9, 11, 9, 12, 8, 12. So we're at 11.2. It was at 1.8. That's what put us up over. And percent of inpatient beds stayed the same, about 3.1. So a bit of it up, which isn't surprising. Hospitalizations, you can see a little bit of a curve upward. Still relatively flat when you compare to these two big peaks. This is the one on the left is the first one that we had, the Delta, and then the second one would be Omicron. Omicron was a less severe, didn't generally replicate very well in the lungs as opposed to Delta, but there was just a boatload more cases, a lot more transmissibility, so you saw more of a hospitalization. And those are our two peaks. And then you see sort of this up and down sort of pattern that you've seen since the vaccines, the boosters, and Omicron, and all the different variants within Omicron. This is sort of where we're at. So it's not out of where we haven't seen since the spring. It's very, very similar, up, down, but not severe ups. This is our incidence rate. We're a bit high, 11.4. We're 1, 2, 3, 4th highest. 5th highest. So, we're a bit high for our incidence rate. Again, these things have an ebb and flow. We're on the higher side right now. Our positivity was sort of in the middle at 7.24%, and this is for the county. So, as far as confirmed cases, I think it was 4,800, something like that for the last 2 weeks before this, 5,000 now. So, again, a little bit up. Nothing like, again, the two peaks that you see are the Omicron and the Delta, and then sort of stay sort of in a up and down meandering sort of path. Wastewater, you can see this is a really good way to see up and down. So in the far left of both of these two charts, you see it coming down from Omicron. That's how many, it was off the chart, so it goes way off. Comes down, flattens out. And then you see this up, down, sort of an up and down pattern with a backup pattern more recently. Up, right? Up, down, and upward. So it's an upward swing in wastewater. This just measures, basically measures COVID in wastewater using their RNA signals. This is MWRA. They're all pretty much similar. So there is an ebb and flow to it, and we're on an upward swing, which, look at the date, look where we are. We're getting into the holiday season, and this is what happens. And I think this is going to be normal. I think colds and flus also would probably follow in a pretty similar pattern, so at least this time of year. Again, booster doses are available. If it's been for 5 and older, if it's been at least 2 months since the last COVID vaccine dosed. What's out there now is the bivalent. Go on vaxfinder.mass.gov. Last we looked, Nurse Kathy looked on Friday, and there was plenty of open slots in the farm. Especially the Four Cs has one that is, I think, over the weekends. That had some open slots. Pharmacies are sort of hit and miss. They get some in. They open up a lot of slots when they get some in. I'll show you how many doses were given. There are appointments. Children under 3, you really should start with your pediatrician's office. In terms of testing, home kits, I've just recently gave some to the senior center. I think the service center still has some. You can also order yours as well. There should be plenty available. Falmouth as far as testing. Now, if you want to have a PCR or a rapid antigen, that's not PCR, that's proctored. Convenient MD. The pharmacies do some testing. Hospital, I think this last time I checked, is still doing it. So there are testing options. But the home kits, if you test negative on a home kit with symptoms, you should test again in 24 hours. But if you're positive on a home test, you're positive. So they're good at determining positive. Sometimes you may not have enough of a viral load for it to show up. So you should always, if you had symptoms and you were exposed, let's say everybody in your family's got COVID and you got COVID symptoms, just because you test negative doesn't mean you don't have it. You should test a second time after about a day or so, because just the home kits, if you have a low level, don't necessarily show up. But once it's there and it shows up on the test, it's that. It's no false positive, not as much false positive, that's for sure. So home kits are the way that most people are doing it. As far as vaccination, it was 642 doses in that 2-week time frame up to 11/28. 402 second boosters, 106 first boosters, and 62 new and 72 second. So, and most of the new shots would be in the younger generation, the 0 to 4, 5 to 11 is where you see most of those. And with the boosters, you see it's sort of mixed, but definitely over in the older, those over 50, you see most of the jump. In terms of what's out there, it looks like a rainbow pattern. If you've watched me on these previously, you might see 1 or 2 or 3 different variants floating around. If you look at the far right, you see that the BA5 is trickling away after having its sort of moment in the sun. And then now you have the BQ1, the 1.1, the BF7, the XBB, and all these other, see all up on the top, you see all these other colors that are just like low percentages, 1, 2, 4%. And one of those will just sort of take over or be a multitude like you're seeing now. So the last month or so, you see that there's been a mix of different Omicron-based sort of variants. And the second boosters, I would seem, would be effective on all these different Omicrons that are out there. So I think as long as it's Omicron and things are sort of taking this pattern, which, we think we probably would have thought would happen over time, even at the beginning of the pandemic, that eventually they become, more and more variants, but there are still more in that Omicron world where they don't cause nearly as much lower respiratory and hospitalizations. They can still, obviously, if you're got a weakened immune system or very elderly or for some reason you had some of the comorbidities, and especially somebody with comorbidities who has not been vaccinated, even Omicron can easily put you in the hospital, and you do see it. You still see people going in there. You can see it when I showed you at the charts above. So still take it seriously. Get your second booster. The new booster has been really good with Omicron, from what I can tell. And so, we're just going to keep riding this train of different variants. And so for my recap, we're medium. It is trending higher, not a surprise for the time of year. There is plenty of vaccine and testing capability. There's the bivalent boosters out. BA.5 is no longer the dominant strain. There's a bunch of different Omicrons out there. No new, any talk, any discussions at all with new mandates. Nothing new coming down the pike with mandates at this point in time. So that's what I have for a recap, and we'll do this in a couple of weeks, unless something changes. Okay, thank you.